Hey guys, so I thought I'd make this video mainly for those of you interested in learning more about radio frequency ablation. It's a procedure I recently had done on my neck, and I thought I would share my experience with what happened during and post-op so that others who may be contemplating having the procedure done will be able to make an informed decision as to whether or not they want to go forward with the procedure. Before I get into the procedure and the post-op results, I thought I'd share with you quickly the reason why I had a radio frequency ablation, and that is because years ago I was involved in a car accident and suffered whiplash. The whiplash went untreated because I didn't know I had it and resulted in arthritis in my neck. And radio frequency ablation is a procedure that has done wonders for people who have suffered this type of injury. And over years, I've tried a number of different therapies, neuromuscular therapy, physical therapy, acupuncture, massage therapy, and all of those I had little success with. So when it got recommended that I try the radio frequency ablation, I figured, hey, why not? I had little to lose at that point. This is actually my second go around with radio frequency ablation. I had it done 2 summers ago on my neck, and what people don't realize is that oftentimes the nerve endings grow back, requiring additional treatments. And that's what happened in my case. I was able to go almost another full 2 years before having to go back in and having another radio frequency ablation procedure. Some people, it only lasts 6 months. I count myself as being fortunate that it lasted as long as it did. Also, I just want to mention I will be going in and having the other side of my neck done. They only do one side at a time. And since the left side is the side I experienced the most trouble with, that's the one they did first. And in 2 weeks, I'll be going back in here and having the right side done. One thing I want to mention before getting into the actual procedure and the post-op results is managing your expectations. And what I mean by that is I think it's important for people to realize that everybody is different and everybody's going to get different results. And I think it's also important to realize that the goal, the overall goal, should be reducing the amount of pain and the number of days that you're in pain. Now, you may not necessarily have the experience where you have the procedure and now, oh, suddenly you're pain-free. But what you may find is that your quality of life has improved because maybe you're not in as much pain, or you're maybe not having as frequent pains, bouts of pain. The procedure itself is minimally invasive. And when I say minimally invasive, I mean minimally invasive. As you can see here, there are 4 little puncture wounds in my neck, and that's it. There's been no bruising. I actually have a bigger bruise on my wrist. I don't know if you could see that. Probably not. From where they stuck the IV in. And that's it. As for the actual procedure, what happens is they insert a thin gauge hollow needle, and it's through that needle that they'll send the radio frequency wave that'll end up burning off the nerve ending. That gets stuck into the facet joint, and before they do any kind of burning, they do a test. They stimulate your nerves to make sure that they're in the right spot. And this time around, there was some difficulty in finding the exact spot where they wanted to burn. They actually had to test multiple times to make sure that they weren't inadvertently burning off nerve endings that would have affected the use of my hand. I remember them asking about probably 5 or 6 times where I was getting the feeling in my thumb and fingers rather than in my neck where it was supposed to be. So that was a little bit unnerving that at first they couldn't find the correct location. For those of you who are wondering how painful the actual procedure is itself, I'm going to start out by saying this. Everybody experiences pain differently. Everybody has a different pain tolerance. So what I experience isn't necessarily going to be your experience. As far as the amount of pain I felt, for me, it was nothing more than what I'm already accustomed to on my worst days with the chronic neck pain. And, you know, for some people, I know they've experienced excruciating pain. I watched a YouTube video where a woman described it as feeling like hot lava running down her back into her legs. Either I'm very fortunate or she was very unfortunate, because that was not the case for me at all. As for post-op recovery, you're going to find that the ice packs are going to become your best friend. For me, I found that icing at the recommended intervals, which my doctor recommended 20 minutes on, 40 minutes off every 1 to 2 hours. I probably was doing it once an hour the first day, the day that I got home. Something you may or may not experience is a feeling in your neck that I can only describe it like this. It feels as if somebody has placed their hand on the back of my neck. That pressure, that feeling that you get as if somebody's touching you there, that's a sensation that I've experienced since having the procedure. It was more prevalent the first day. The first day especially, my neck felt really stiff as well. Overall, I think I've experienced less post-op pain this time around than I did the first time. And I'm attributing that to the fact that they gave me a steroid shot along with the ablation. Now, I don't know if they gave me a steroid shot the first time around. I can't remember. But I do know that it does feel like I'm experiencing less pain overall with the post-op recovery. The last thing I want to mention is that you may experience being tired and possibly a little bit irritable. Just saying. Especially if you're having the post-op pain, which is different from your normal pain. And when I say different, I mean different in terms of location and the type of pain. Maybe not necessarily different in terms of intensity, but it is different, and it can lend you to feeling a bit irritable. Also, I'd imagine the after effects of the sedation can be attributed to that as well. The best thing you can do as you're going through the post-op recovery phase of the ablation procedure is to listen to your body. Now, I have a tendency to overdo it when I start feeling good, and over the last couple of days, my body's had to remind me by going, hey, sending more pain signals or making me feel tired or what have you, because I start overdoing it because I'm thinking, yeah, I'm feeling pretty good compared to my normal. So yeah, it's important that you remember you're in recovery, and it's best to take your time and get your rest and do what you need to do to get beyond this post-op phase.